Hello, this presentation will be on allergic rhinitis, coughs, and colds. Allergic rhinitis is an inflammatory disorder of the upper and lower airways and the eyes, causing sneezing, rhinorrhea, pruritus, nasal congestion. It can be seasonal or all year round, triggered by airborne allergens which bind with the IgG on the mast cells and triggers release of inflammatory mediators such as histamine, leukotrienes, and prostaglandins. The classes of drugs used for allergic rhinitis include the glucocorticoids, antihistamines, and the sympathomimetics. The intranasal glucocorticoids are usually the first choice for prevention and treatment. Mild side effects occur, such as drying of the nasal mucosa, sore throat. For those, I usually advise patients to use a nasal saline spray to help keep the passages moist because it can lead then to the nosebleeds. There can also be headaches, and there are rarely systemic effects such as adrenal suppression and slowing of linear pediatric growth. With your oral antihistamines, they do not reduce the nasal congestion, and they are most effective if they are taken prophylactically because antihistamines do not reverse what's happened, it only stops further occurrences. So they should be taken every day before symptoms start to prevent activation of the histamine receptors. And the side effects that's usually a problem for patients is the sedation, and that is usually the worst with the first generation antihistamines such as Benadryl. Much less so, if at all, with the second generation such as Claritin and Zyrtec. You have your intranasal antihistamines such as Astelin. These are used in adults and children over 12. Um, if they're used on a regular basis, they can cause some sleepiness, even though that usually tends to get better with time. Again, the nosebleeds, so use of the saline. There can be some dry mouth associated with use and some unpleasant aftertaste. The intranasal cromolyn is another medication that can be used to suppress the histamine and other mediators. Again, you want to use it prophylactically, but it does take 1 to 2 weeks for those to become effective for the patient. So you may have to give them something else in the interim, such as a oral medic preparation. And of course, Benadryl, first generation, works well and works quickly, but you do have to watch for the sedation. With the sympathomimetics, they reduce the nasal congestion, but do nothing for the rhinorrhea, the sneezing, or the itching. With these, you have to watch about rebound congestion, central nervous system stimulation, and any cardiovascular effects. So you'd be very careful, if at all, with patients with uncontrolled hypertension or serious cardiovascular problems. And you do have to watch for potential abuse of use with these, especially with the nasal preparations. So you have your pseudoephedrine, ephedrine preparations. With these, that would be like your Sudafed, so you'd have to be very careful. And we know with the ephedrine preparations, you do have to be careful with any cardiovascular effects. with the combination of the antihistamine with the sympathomimetic um, ingredients, those drugs are very effective, such as your Atrovent, your Singular, which works on your leukotriene um, mediated symptoms, and then your Zolar. Our drugs for cough, these drugs suppress the cough, so we have your opioid antitussives, such as codeine and hydrocodone, which you would definitely want to use with caution with patients for to watch for an abuse, especially with those that have a drug abuse history. So those would be reserved for someone with a very severe cough um, and that is not getting any sleep at night at all. That's usually when you want to give that. And so for the most part, you're going to give a non-opioid preparation. Even with the dextromethorphan, you have to be careful. There is abuse there also, and teenagers can, of course, buy that over the counter. Um, your diphenhydramine, which would be your Benadryl, uh, can be used to help dry up the secretions, which trigger the gag reflex and coughing. And then you have your Tessalon pearls, which is the last mentioned medication there. Those have been around for a very long time, but they can be effective. They will anesthetize the cough center, and that would help to, of course, reduce the cough. You also have your expectorants, and which help to make a cough more productive, which is helpful to stop that dry hacking cough. And Mucinex I believe is a very effective medication for that, which is over the counter for the patient. You have your mucolytics, which are not used on an outpatient basis necessarily, but can be very effective for the cold. Then the common cold is usually a upper respiratory viral infection with the runny nose, congestion, cough, sneezing, sore throat, headache, um, body aches, fatigue. Fever is more common in children, and usually that fever is worse in the evening and then is gone um, basically in the daytime, or it comes and goes throughout the day. It is usually a self-limited benign condition. There's no cure, so we just treat the symptoms. For colds, we use over-the-counter products that are here. The caffeine, as it states, can be used to offset the antihistamine, which I would not recommend advising to your patient. They will probably figure that out on their own if they're coffee drinkers. Caffeine also has some bronchodilation effects, so sometimes they may feel that it helps to ease the chest congestion a little bit. And lastly, we want to caution about using OTCs with children younger than 4 to 6. Most of the medications do not recommend use younger than that, or some at least down to the age of 2. So for the very young child or infant, it's basically humidifier, saline, keeping the nose suctioned well, um, and just doing comfort measures, um, Tylenol or ibuprofen if they have a fever to help keep them comfortable. It's important to make sure the patients are measuring the drugs with appropriate measuring devices, such as syringes that they can obtain from the pharmacy or from their provider. Um, and if the child doesn't get better, they need to be taken in to be checked out by their pediatrician. And you want to avoid using a lot of antihistamine type products that will sedate the children. Now on to questions. What if the patient asks which would be the most effective of these drugs for seasonal hay fever? The answer would be C, the Flonase, which would help to, which is the intranasal cortical glucocorticoid. And question 2, the patient is prescribed the codeine for the cough. What would the nurse observe for with this patient? And the answer would be A, respiratory depression. And that's why we don't want to use that on a regular basis with patients with their cough. And that is it for this presentation. Thank you very much.